Greetings and welcome to EHA Unplugged, the official podcast channel of the European Hematology Association, EHA.
Hello, welcome to this EHA Unplugged podcast. We are here today to discuss the application of artificial intelligence to morphological diagnosis in hematology. Our guest today is Mahesh Prahladan, and Mahesh will introduce himself.
Thank you very much for giving me the opportunity to be in this podcast. I'm Mahesh. I'm one of the hematology consultants based in a jurisdictional general hospital in Suffolk in UK. And I work as a visiting professor to one of the image analytic lab in University of Suffolk. And we have joint collaborative projects in AI, in morphology and clinical parameters involving patient care in various hematological disorders there.
Thank you for being with us today. So, the development in machine learning and deep learning models have led to the development of AI systems that have been applied in various areas of hematology, including digital pathology. And these AI system methods have shown promise in improving diagnostic accuracy and efficiency. So we would like to discuss with you today what is the state of the art for artificial intelligence-assisted diagnostic morphology in hematology. Do you want to illustrate it to us?
Implementation of AI in morphology and hematology testing is not new. It's been going on for the last few years. But what we have seen over the last few years is a rapid development or rapid rise in the implications of AI, which gives you a faster tool, accurate tool, and I won't say to replace the existing system, but to augment and improve the accuracy, and thereby developing and improving the patient care. And that is how I see AI in the diagnostic purpose. As you probably see in the last 5 years, we have a genomic data which is included in the diagnostic purpose in most of the hematology disorders, which will affect the prognosis, diagnostic accuracy, and including these parameters. I think it may be sometimes you have to rely on AI to give you accurate and robust data in a efficient way, and that in a way that will increase efficiency. Also, we will increase the productivity of any lab that we use. And I can see that the AI will be implemented straight from the diagnostics till we go through the patient journey to the end of the treatment. So I feel that there's a lot of implications on AI in the current world.
Yeah, can you give us a basic understanding of how it works?
So I'll start with our project, which we used and in our lab. I think in the height of COVID, we had a HRA-funded, approved research project to look at some of the lymphocyte, single cell lymphocyte morphology. And we used one of the image analytics, AI and machine learning, deep learning neural network to see whether we can pick up patients just based on one variable, especially the lymphocyte morphology, to diagnose very efficiently and on diagnosing patients with COVID. So what we did, the first step is what we call as a supervised learning. We teach the machine to understand how does the lymphocytes in patients with COVID looks like. So we had a cohort of patients which we went through with three other morphologists and taught them this is how we need to learn. We had two other cohorts in patients who had viral infections like EBV, and the third cohort was patients who hasn't had a COVID. We found it very easy. We went to all patients who had normal blood tests just before the COVID, and we picked up those patients. And in the interim analysis, it was quite interesting. When we did in a normal person from looking at them under the microscope, we pick up around 2 to 3% of this abnormal morphology in patients with COVID. And as we did our interim analysis, we picked up almost 87% sensitivity and specificity in diagnosing patients with COVID. And that was a interesting learning. And obviously the main issue is a human bias which come through. So what we did was we did a unsupervised learning, and we picked up how the machine can find any particular features or patterns in the lymphocytes that can pick up, and they can pick up almost 80 to 87% 100% just on one variable. So we didn't look into other parameters like fever, LDH, lymphocyte counts, and there are lots of other parameters which would probably help. But this project, which made a huge surprise, we were not expecting that, but it made a huge implications on how we can diagnose COVID efficiently. Hopefully, I don't think that we need to have COVID come back again, but if in the case we can apply the same technology to rest of other infections, or we can pick up those parameters, and that will be our future projects, and probably to put this same technology into diagnosing common hematological disorders.
Yeah, I see that this tool seems to work very well for innovative diagnosis. Do you think there are also other potential applications, for example, in the prognostic stratification of patients, discovering new diagnostic groups?
So that I'll come with our second project, which is just on the process of approval at the moment for funding. So here we're using the simple technology at the moment. So we, for example, patients with high-grade lymphoma gets a PET CT scan before, and they go through the treatment. We are adding a image analytic, again machine learning technology, how to assess the volume of disease on a PET image prior to the treatment, and adding other variables, which is existing variable like IPI scores and the performance status and ECOG, adding on to that value, whether that would predict in terms of how prognostically we can classify these patients on PET range metabolic volume. So we're doing this project at the moment. We're waiting for some of the funding projects to happen, and this will clearly show us in terms of how things are. But on a diagnostic front, for example, like leukemias, where you have the genomic stratifications and classification, at the moment we do an integrated report, but that is based on individuals sitting through analyzing each mutation, whether they are pathological, pathogenic mutations, and looking at the data. But all these are going to be it's not very sophisticated machine learning projects, but we can integrate most of these steps into a algorithm where we could produce a result which is quite robust and better than taking off the human factors away. What we're trying to do is not to replace humans. We are trying to make sure that we open to what we're doing, and perhaps focus on humans and factors to other things that which we need in the prognostication and classification of the disease.
Do you think this kind of technology can also be useful to enlarge accessibility to very accurate diagnostics? For example, allowing remote digital diagnostics to small peripheric centers or to centers in low middle income countries.
So our first project about diagnosing morphology-based AI to diagnose COVID. For example, in Bangladesh, when the height of the COVID, we had just one center, the entire country, they can do like 100 patients. If we can throughput this into a routine process, this is a very simple test. We're not looking at PCR, costly analysis. Everyone will be affordable. The care can be kitable all around the globe, regardless of them. And a centralized service, if there is a issue with training and recommendation, you can have a centralized view where we could have an expert opinion about a diagnostics for most of the conditions in a digital world. I think the world is moving into that line, and I think with the new technologies, that is including the incorporation of these, make life easier, cheaper, and approachable or equitable to everyone, and sustainable as well, because this doesn't have various resources, or it's just have very simple, like a drop of blood, look at the one, and the old H&E will get the diagnosis accurate.
Okay, very good. And going on the other side, which kind of challenges do you think may arise in the implementation of these techniques? For example, economic issues or regulatory issues. There are approved commercial platforms. Do we need new regulatory framework for this?
I embrace the EHA's aim in terms of we need to be sustainable, we should be equitable, and it should be, the implementation of the technology should be ethical. Wherever we go, I think, and hence I think we need the regulatory requirements for that. What I can see from my personal opinion, we need to have three stakeholders. One, the paramount important is a patient group. Second is the regulatory from the government sector, and the scientific regulatory board. And this should be harmonized in a way that we should have a balanced equilibrium of where we can implement this, at the same time not do it in a haphazard way where we disrupt all the services. One of the early discussions, what we felt that one is about the training of this, whether we would replace everything. I always allude that we should not disrupt the existing system. We should try to augment whatever we have with the technology here. And ultimately, the aim should be to implement the technology in such a way that it will help the patients. At the same time, make sure that we make a huge implications into the disease modifications, the disease stratifications, and the treatment. Again, we are all moving into personalized medicine, and this is what we are looking at. Again, that would be a huge implications in terms of from the accuracy of the diagnosis, and just the journey of that slide going through the patient's journey with the treatment and their outcome as well.
Do you have any suggestion on how scientific association like EHA may have a positive impact in the development or diffusion of these technologies that you are describing to us in terms of education, awareness, promotion, or any other potential action?
I would say from my personal opinion, attending EHA has helped me to think about when I was a member of the morphology working group, and thereby I thought about the genomics bit, which I do not know. I did a degree in genomics, and thereby I learned about the implications of AI in one of these projects, and that led into the first project as a master's project. Again, EHA, as you've probably seen, we have a new award ceremony, it's an award category for innovations and implications. So that again, it shows that one of the EHA's role in subsequently developing all these resources. And I can see there is computational biology and hematology training, which is one of the wonderful courses, collaborating with the European Molecular Bioinformatics Lab and the Wellcome Sangers, which again supports the whole process of training, as well as the imparting this knowledge to the rest of the world. And EHA is the best example of how we can support this technology. And as one of the biggest organizations, I have a huge just respect to and the work that the EHA has been doing for the entire medical community.
Thank you very much, Mahesh, also for these kind words and for this interesting conversation. Thank you.
Thank you very much.